Hello everyone, this is Lisa Kamibayashi. Today I'm presenting the West Los Angeles College Bachelor Degree in Dental Hygiene program. To make sure you understand how dental hygiene program works at the West Los Angeles College and preparing for a career as a dental hygienist. First of all, I would like to introduce myself. My name is Lisa Kamibayashi. I'm the dental hygienist and also I'm the program director of dental hygiene program at West Los Angeles College. My email address is right here, and then I'm located at the MSB building in room 105. If you have any questions, please call 310-287-4464. That's the main office number. Someone will return your call. Or 4457. I'm also teaching during the day sometimes, so you will not be able to get me in person all the time, so you have to leave a message. The best way is contact me via email. So, are you the first time coming to my website, our website, and then you are not the West Los Angeles College students yet? You need to make sure you are West Los Angeles College students. It's very easy to become a student of West LA College. Basically, you have to apply. You can take the application workshop that will be offered through the college, through the non-credit program, or you have to, make an appointment with a counselor. In order to do those things, you have to have a student ID number, and then you have to become a West LA student. If you are already a student from other colleges, such as East Los Angeles College or Valley College, in one of those 9 campuses we have part of Los Angeles Community College District, you don't have to worry about that. You use your ID number and then contact the West Los Angeles College. First of all, I want to make sure I'm presenting the career of dental hygienist. It is a licensed professionals and who has to complete the extensive educational program. Most programs are 2 years long or even longer, 3 years. Our program is about 22 months length. And then it requires a lot of extensive academic preparation and also clinical preparation. Main goal is in preventive oral health care to the public. These are the duties that is allowed in California. Each state has a different regulations, license. California is a very advanced state, and then we are allowed to do many things such as local anesthesia, nitrous oxide sedation. Now you can be trained for interim therapeutic restoration, ITR, in our program at West Los Angeles College. So these are the functions, and then you can check it out. And then if you're going different states, you may want to check their duties and then functions at their states. Our profession, dental hygienists, are very attractive because many people work flexible schedule. You can work as a full-time or part-time, and then you can choose to work in various dental offices, like general office, general dentist, aesthetic dentist, periodontics office, or endodontic, pediatric. There's so many variety. Many part-time dental hygienist works as a maybe 1 or 2 days a week, or sometimes 3 to 4 days, and there's a lot of flexibility in scheduling and profession. Other than clinical dental hygienist, you can also be a public health administrator or manager, educator in dental hygiene and dental schools, researcher, sales rep, or independent practice. Because West Los Angeles College offers bachelor degree now, you are more likely to be hired as educators and researcher or sales reps at the corporate level. We also offer the RDHAP program, which is independent practitioner for dental hygienists. Job outlook is great. Most dental hygiene professionals in any state are increasing in demand. And dentists are hiring hygienists for preventive procedures, and then they can focus on more restorative work. And also dental hygienists can maintain the pool of patients for the maintenance recalls and recare program. Currently, the job market outlook by U.S. Department of Labor is stating they are expecting about 90% of increase in job outlook. So if you're interested in looking for more current statistics or even other occupations in United States, you can go to Department of Labor, Bureau of Labor Statistics, and then look it up what is the great job for next 10, 20 years for your future. This is the California figure. And also the wages. Dental hygienist is known as a very high-paid job. Right now, median salary for a year in California is in red. That is about $96,000 a year. Some people work full-time and then more. They're expecting more than $124,000. Even part-time, they may be making $60,000 a year. This figure is going up, and then again, California offers this statistic at the labor market information site. Earnings. Right now, Los Angeles County's current median hourly wage is $47 per hour. It can be changed by geographic location, employment setting, and experiences. So one of the things the dental hygienist may not be getting is benefits. And then because of many of the dental offices are small private offices, and then many offices may not hiring the dental hygienist as a full-time. So one of those fringe benefits may not be available for dental hygienist. The future is great, and our occupation has a lot of great benefits. However, I want to make sure everybody is understanding of there are risks with our occupations. Occupational risks such as occupational exposure. You will be working closely with bodily fluids such as blood and saliva. That means you may potentially contact unwanted disease such as hepatitis B, hepatitis C, tuberculosis, HIV. Very often, dental hygienists get more pulmonary upper respiratory disease due to a lot of aerosolized particles in the environment. So that's something to consider if you have some medical condition that is likely affect your health. If you have immunosuppressive disorder, it may not be the suitable condition to work in. Occupational risk 2 is you will be exposed to different hazardous material such as dental radiation, mercury, chemicals, disinfectants, nitrous gas. So it's just a caution. We do protect everybody from not getting this exposure, but we want you to be aware of we are surrounded by different hazardous material in our environment. Occupational risk number 3 is ergonomic risks. Dental hygienists often work all day, 8 hours a day, and then sitting down position, and then using the arm and wrist to move same movement over and over repetitively. That may cause carpal tunnel syndrome, any other more neck and shoulder pain, back pain. So there is a potential back, neck, and shoulder occupational injury. If you have any previous or current condition that is going to affect you or make it worse by doing this all day sitting down position and repetitive motion, you may want to consider to find out if it's suitable to pursue in this career. So, how to become a dental hygienist? The best way to find out how to become a dental hygienist is offered through different associations. California Dental Hygiene Associations, American Dental Hygienists Associations offers different programs and informations for the possible applicants in the future. What is a dental hygienist? Where are the schools? Who are the accredited programs? All that good information are there for public. First of all, everybody should be enrolled in the program that is accredited by Commission on Dental Accreditation, known as CODA. If your program is not CODA accredited, you will not be licensed in California, and then you will have a difficult time licensing in other states also. So first of all, check your programs you're applying are CODA accredited. Now, how you finish getting the licensure. So first of all, many states require to graduate from CODA accredited programs. And then those CODA accredited programs is at least 18 months or 2 years long. And then usually most programs are full-time. That means 8 a.m. to 5 p.m. Monday through Friday. In our program, bachelor degree program requires 65 units of total upper division courses. Once you complete this program, you'll be allowed to take National Board examination. This is a computer-based multiple choice questions. And usually you're going to be asked to take this during the last semester of the 2-year program. Upon passing successfully the National Board exam, you'll be taking Regional Board exam, which is a practical exam. You're going to be working on the patient. However, there will be a background check will be conducted before taking this exam. So make sure you don't have no felony convictions, and then fingerprinting will be required for Department of Justice and FBI. And also clinical exam on a live patient will be conducted. So you have to be safe, and then patient has to be selected safely for this exam. Each year, the criteria changes, so our program will inform the candidates or the students in our program to prepare for this exam. That usually happens after graduation in June. Now, after you finish both National Board exam and Regional Board exam, you will be eligible to apply for California license, and then you will be eligible to take California Ethics and then Practice Act exam. So all these 3 exams must be passed in order to apply or obtain California dental license. However, other states has their own process, and then you need to check their jurisdiction for their process. Now, a little bit about the West Los Angeles College Bachelor Degree Dental Hygiene curriculum. It starts in end of August, and it is a 4 semesters, and then 2 winter and 2 summer sessions. That means 87 weeks you're committed in the school. That's about approximately 21 months. So less than 2 years, but basically around 2 years. Upper division major courses units are 65 units total, and that link right here will show you which courses will be taken during the semester. Average 14 to 15 units per semester, so that's a full-time workload, and about 6 units will be offered during winter sessions. So now, going back to how to apply West Los Angeles College Bachelor Degree Dental Hygiene Program. First of all, you have to become a student at West LA College. Apply online at www.wlac.edu. Also, if you're coming from other than Los Angeles Community College District, you have to send in your official transcripts to the admission and records from other college and other universities. So your units you have taken is counted towards your IGETC and CSU transfer. Then obtain student ID number. I highly suggest to make appointment with counseling office. It could be actually done at your own college or highly recommended to at West Los Angeles College. Then you could have a set student educational plan, which includes lower division courses to make sure you finish all the prerequisites for the dental hygiene, and then also all the GE courses, certification courses, CSU transfer certification, or intersegmental general education transfer curriculum, also known as IGETC. IGETC certification needs to be verified by counselor, and then you will be eligible to apply the dental hygiene program. And then also complete the dental hygiene prerequisite courses, and which I have another slide to show you. And then this site, the link is giving you the most current list of CSU transfer and IGETC ZE requirements. If you don't check it often, that may change. That requirements will change year to year. So make sure you update your list. And then once you get certified, you will be eligible for applying our dental hygiene program. Another important thing is you have to be financially ready. So if you think, or even you don't think getting into our program, best to apply for FAFSA financial aid as soon as possible. The FAFSA application opens in October or November every year. So if you apply and you are ready, even though the program doesn't start till the August of that next following year, sooner you apply, you are more eligible, and your disbursement may come much earlier than expected. BOG waiver is also applies to our upper division courses, and then if you are eligible to get the BOG waiver, your $46 unit, 46 per unit tuition will be waived for even upper division courses. Now let's talk about the prerequisite to getting in West Los Angeles College dental hygiene program. Again, you have to have CSU transfer or IGETC certified, or will be certified. Very last semester, you are finishing one last course. We do accept that, but you have to show the proof that you are only waiting for one more class, and you will be done before you getting into the program. Science prerequisite. The courses are anatomy with lab, physiology with lab, chemistry with lab, microbiology with lab, biochemistry with lab. Biochemistry is the newest prerequisite, and in our West Los Angeles College, we offer Chemistry 66 or Chemistry 212. Chemistry 66 only requires the Intro to Chemistry level as a prerequisite, so many applicants take this Chemistry 66 for biochemistry requirements. These science classes must be completed within 7 years to be eligible. If it's more than 7 years, you have to retake those classes again in order to be eligible to apply our program. Also, if you take any of these science courses within 7 years, repeating or retaking the classes to improve your grade, we will average those grades of how many ever you took. So be careful. Make sure you are taking these classes within 7 years, but do well in those times. But if you're retaking, the grade will be averaged. Non-science prerequisite courses are psychology, public speaking, which is not interpersonal communication. It has to be public speaking component in it. Sociology, cultural anthropology, and English 103, and then statistics. Okay. So now the selection criteria. All those science prerequisite courses has to be average of B average, which is 3.0 GPA. Now, non-science prerequisite courses has to be average of 2.5 GPA. Therefore, some people choose to retake some classes if they are on too many C's in sciences. But again, if you have taken those science courses within 7 years, will average the grade on the selection process. Overall GPA from all colleges and universities will be looked at. So please submit all your transcripts from all the colleges and universities attended. If not, and if we find out, we'll think about this as a false information. Other advisable courses for extra points are medical terminology, nutrition, political science, physics, organic chemistry. And also degree earned. If you have a degree earned, such as AS degree, BS degree, MS degree, you'll be receiving extra points for those. Also, we are encouraging a lot of students to take these courses at West Los Angeles College. So we do consider students who takes courses at West Los Angeles College as a more higher priority than people who never took the courses at West Los Angeles College. Now, other requirements for application process is observation of dental hygienist for 4 hours. Also, it's not required, but dental experience is highly advisable. If you got the paid position up to 4 years, such as dental assisting, registered dental assistant position, we will look at your W-2 form as a proof to give some points towards dental experiences. Other selection points we can consider is dental licenses and certification, such as registered dental assistant license, RDA EF license, cornea polishing certification, radiographic certification, infection control certification are all extra points for your selection process points. More requirements are added recently. Once you are ready to apply our program within a year, G certification and then dental hygiene prerequisite courses are almost done. Then I would like you to get or ready to take the standardized test called TEAS test. Okay, and then you have to submit that score. Preparation for the TEAS test is available from this institution called ATI, Nursing Education. And more information can be obtained from our website. But we only take one score within 1 year. So please do not take this test over and over to improve your score. We would like to see just one score 1 year. Also, your application forms will be ready during November of the year before the application year. So then you can download the application from our website, and then every year deadline is the first Friday of March. And then application forms usually about 10 to 15 pages, and you have to follow the instruction, read the information, and then fill out all the applications correctly and with necessary material, supplemental material in one packet. You can walk in the whole packet or you can mail it in the packet. We'll send you the confirmation of receipt as soon as we check all the application material. Also, you have to send the official transcript from all colleges directly to dental hygiene department. However, once we receive those official transcript, we have to open the envelope and then we have to use it for our purpose. Those official transcript is not going to be sent to Admissions and Record Office, so you have to send another set to the Admission and Records Office for other needs or the official transcript units in our in the college. We are aiming usually letters of acceptance to go out by first week of June. Accepted students orientation is usually conducted the last Friday of the June. And then also 1 month later, mandatory instrument kit payment and then workshop will be given on the last Friday of July. That's the day you will be paying for the student kit, which includes a lot of instruments, educational material you need for individual students to go through 2 years of a program. It doesn't include textbook, but those instruments, dental instruments, are necessary for each student to attain dental hygiene education and then skills during the program. And then at this moment, approximate figure is around $8,000. Again, the due for application is the first Friday of March. All prerequisite courses should be ideally completed before the application deadline, or one course in progress is allowed during the spring semester. Midterm grade of the last in-progress course must be verified by the course instructor no later than first week of April. The instructor should provide a proof of grade on a college letterhead signed by the course instructor. That will kind of give us the proof that you are in good standing and you are most likely to finish the course, and then we can consider you as a candidate for our program. All completed in-progress courses must be in your transcript and submitted again to our dental hygiene program as a final verification, and then also the West LA College admission and records. So a lot of paperwork back and forth if you have in-progress course, but it is durable, but we only allowed one in progress at this time. Application can be denied with following condition. Any missing information on the application will be considered as incomplete application, and the application will be denied. Make sure you follow the provided checklist to avoid any inconvenience. Any false information on the application form will be denied for acceptance and or dismissal from the program. Application without signature will not be accepted. So we are checking to make sure you can follow the instruction on application on your own. Please make it easier for everybody. We get numbers of applications and we don't want to receive different materials one by one. So as much as possible, put everything in one packet and then submit all the necessary proofs for yourself. The final thing is financial aspect. Yes, it is very affordable compared to many other bachelor degree program in the United States. However, it's not free. So financially, tuition is currently at $130 per unit. $46 is for lower division course tuition unit, plus $84 for upper division course unit. Again, the bulk waiver can possibly waive $46. Total of 65 units of upper division courses will be required to take. That is roughly estimate is $8,450 for 2 years of tuition. Instruments, supplies, textbooks are not included in this tuition, and approximately about $10,000 will be asked to spend before starting the program in July. Financial aid disbursement will not usually occur the beginning of semester. It may happen during the end of first semester. So again, FAFSA application is very important for you to start now, and then also be prepared for the time period that when you have to wait for disbursement. So I highly suggest to save and plan for this financial aspect of preparing for the program. Now, housing, our college is located in a very busiest town or city, busiest part of the city, along 405 freeway and 10 freeway. Many students commute long way, and it will take away your study time during the program. Also, many students decide to move in closer to the campus too. So you may want to check the price of housing around the West Los Angeles College area, make arrangement for room share, renting place before you coming to our program. Also commute. As I said, it is just the busiest parts of the city. Easily take extra 3 times longer than usual for the regular commute place. So that's another consideration you have to look at for the gas and extra expense. Also, the parking fee at the campus is not free, and then you will be asked to go to different clinic sites around the city, and then those clinic sites may require some parking fee to park their location. These kind of skill sets are needed for successful dental hygienist, and we are looking for well-rounded students and who can actively listen, be able to time manage, critical think, and likes to writing, likes to communicate, and has a good manual dexterity. So just to kind of make the consideration of you will be asked to gain these type of skills during the program, and then prepare to be ready to get the instruction how to gain these trainings during the program. So we've been going over other things to consider. Definitely financial readiness and academic readiness. But other than that, support from your family and friends are very important. We'll be doing criminal background check that is required by other clinics to make sure. And then also we can guide you in a proper way for if you have any felony or misdemeanor in the past, we have to guide you to make sure you will be ready to get the questions about it when you are getting licensed. Also, physical examination is required before you getting into the program. Drug test will be required, certain immunization, and also titer, proof of titers for immunizations. These are going to be asked once you get accepted into the program, so not immediately at the application time. So please do not worry about it until you got acceptance letter. And then at your orientation for new students, we'll go over these details. So, but just a heads up. Also, dental hygiene rules. We don't allow smoking. We don't allow colored nail polish and artificial nails for infection control purpose. We don't allow the jewelries during a clinic. And we ask all the students to wear navy color school scrubs during the clinic whole time. And then we ask you to have a good attitude and a professionalism during the program. Now, if you have any more questions, please contact Health Science Office. It is located in MSB first floor. Phone number is again 310-287-4464. Our general hours is 9 a.m. to 4 p.m. every day. If you have a more general question, you can contact this email address also. You may get the answer much quicker than my address. So please, email both or use this one first to get the general answer. Also, if you are thinking about getting counseling, once you become the West LA student, that's the phone number for you, 310-287-7242. So this concludes the presentation of dental hygiene program information. This is very generic, and we may have more specific each year on each application period. So please keep eye on the website, and then we will notify you. And then we highly recommend you to attend the information session in person in order for me to help you more privately, individually, better for your circumstance. So all the updated information session dates will be on the website, and so please keep an eye on the website. Thank you for listening, and I hope to see you in person soon.